The 2nd day of July, 1944, a makeshift hospital buried beneath the earth, carved into the rock formations surrounding Cherbourg, France. The white fabric of her medical uniform draped awkwardly across her frame as Dr. Schwester climbed toward the surface from the cave's depths. Her palms faced the sky, a gesture of capitulation. The brilliant summer sun assaulted her vision after countless hours spent in subterranean blackness. A conviction still echoed in her mind, words she'd spoken with certainty to her nursing colleagues just that morning, while they worked in the darkness below. There's no possibility the Americans possess the medical resources they're broadcasting. It's nothing more than psychological warfare designed to undermine our resolve. Those confident assertions would soon crumble, the first domino in a cascade of demolished beliefs. 8 additional German military nurses ascended behind her into the unforgiving daylight, among the earliest German medical personnel to fall into American hands during the Allied push across France. Their final week had been spent administering care to injured Wehrmacht soldiers under flickering candlelight, carefully measuring out their remaining morphine doses drop by precious drop, sterilizing the same cloth bandages repeatedly through boiling and reboiling cycles. What none of these 9 women could have anticipated was the revelation awaiting them in the hours ahead. Medical infrastructure and capabilities that would expose everything they'd been indoctrinated to believe about American inferiority and German dominance as elaborate fiction. These nurses, who'd been providing medical treatment in conditions more reminiscent of surgery during the Middle Ages than 20th century practice, stood on the threshold of encountering a healthcare system so technologically sophisticated, so lavishly equipped, that it wouldn't merely challenge their medical assumptions, it would demolish their entire ideological worldview from its foundations upward. Colonel Richard P. Johnson stood as commanding officer of the 45th Evacuation Hospital stationed at Valognes. His gaze assessed the 9 women before him with inquisitiveness rather than animosity, recognizing them not merely as adversaries, but as practitioners of the healing arts like himself. The Geneva Convention mandated their return to German-controlled territory within days. A total of 16 German nurses would be exchanged through 2 separate operations on July 2nd and July 9th. But before their repatriation, they would be exposed to American medical practice circa 1944. Pharmaceutical compounds they'd only encountered through second-hand accounts. Surgical methodologies that exceeded anything in their formal education. The psychological reverberations would persist far beyond their temporary detention. The foundation for this awakening had been laid more than a year prior, on the 13th of May, 1943, amid Tunisia's blistering desert temperatures. When General Hans-Jürgen von Arnim capitulated, his surrender encompassed not only fighting forces, but thousands serving in medical capacities, physicians, orderlies, and among them D.R.K. Schwestern, nurses of the German Red Cross who had endured 2 years of desert combat alongside Rommel's Afrika Korps. The captives included D.R.K. Schwester Ilse Schultz, recipient of the Iron Cross Second Class that April, a distinction bestowed upon fewer than 20 women throughout the entire conflict. Her colleague, D.R.K. Schwester Greta Falk, similarly decorated with the Iron Cross in April 1943, maintained meticulous records that would eventually surface in German military documentation. She wrote, "The quantity of medical materials the Americans discard in 24 hours surpasses what we were allocated in 30 days. They possess pharmaceuticals we've only heard described in theoretical terms. The magnitude of the capitulation was extraordinary. Between 250,000 and 275,000 Axis military personnel surrendered, including healthcare staff from distinguished units, the 21st Panzer, the 15th Panzer Division, and the 91st Light Division. While the majority of captured medical workers were male physicians and orderlies, the nurses among them would undergo a particularly intense ideological upheaval. American forces processed the captives according to strict Geneva Convention guidelines, with impressive organizational speed. At consolidation sites throughout Tunis, American medical officers categorized captured healthcare personnel within hours of their arrival. Those required to tend German wounded remained behind. The rest were designated for overseas evacuation. Each captured nurse underwent medical assessment using instruments that had become virtually non-existent within the Afrika Korps. By June of 1943, initial contingents of captured German medical staff were embarking on Liberty ships bound for the United States. These mass-manufactured vessels themselves contradicted German propaganda narratives about American industrial inadequacy. The ship's onboard medical sections exceeded anything the German nurses had encountered in their native country. Surgical suites with reliable electric illumination, functional radiographic equipment, climate-controlled pharmaceutical storage, all standard features. Perhaps most remarkable were the blood plasma reserves, properly categorized and refrigerated units suitable for safe administration, a stark contrast to the hazardous direct blood transfers that German forces still attempted under field conditions. The Atlantic Passage revealed American medical abundance on a daily basis. Sulfur powder, which German forces rationed grain by grain, was applied liberally. Dressings were discarded after a single application. German healthcare workers who had subsisted on adequate rations observed American medics throwing away unconsumed food portions, waste that would have been inconceivable within the Wehrmacht. Vessels carrying German medical personnel arrived at harbours ranging from Norfolk to New York. Their initial view of America dismantled years of propaganda about a nation supposedly crippled by economic collapse. At Norfolk Naval Base, medical intake procedures included thorough examinations for every captured individual. Dental procedures were performed. Infections received treatment. Those requiring vision correction were provided with eyeglasses. This standard of care surpassed what was accessible to German civilians back home. The railway journey inland delivered continuous epiphanies. Municipality after municipality showcased illuminated medical centres. In Richmond, the Medical College of Virginia's complex was visible from passing train windows. In Philadelphia, Pennsylvania hospitals' commanding architecture could be observed. Every metropolitan area possessed healthcare infrastructure that exceeded facilities in Germany's larger cities. During a stopover in Washington, D.C., American Red Cross volunteers entered the train cars to distribute parcels to the German POWs. Toiletry items, cigarettes, chocolate, correspondence supplies. German nurses, thoroughly indoctrinated in racial conflict ideology, struggled to comprehend this benevolence directed toward adversaries. Camp Opelika, Alabama commenced operations in September 1942 and began receiving Afrika Korps medical personnel that June of 1943. The camp's hospital evolved into an extraordinary environment where German medical staff, trained in Nazi racial medicine, collaborated alongside Americans practicing evidence-based clinical care. The parallel staffing arrangement adhered to Geneva Convention mandates. American medical officers maintained oversight while German personnel delivered hands-on patient treatment. This created an unprecedented circumstance: enemy healthcare workers operating within the American military medical infrastructure. The installations astonished the German nurses. Operating theatres contained apparatus they recognized only from academic literature: electric cauterization devices, adjustable surgical illumination, rapid cycle sterilization autoclaves. The dispensary housed hundreds of medications in temperature-regulated storage, with expiration dates extending years into the future. On July 21, 1944, Glennon General Hospital in Okmulgee, Oklahoma was redesignated as German Prisoner of War General Hospital No. 1, featuring 1,690 beds staffed by parallel American and German medical teams. Colonel Henry W. Misch implemented something unimaginable within Nazi Germany: integrated medical teams exchanging knowledge across enemy boundaries. German nurses from the Ernst-Schwestern-Schaft, who had been taught that American medicine was feeble and morally corrupted, discovered instead a system grounded in rigorous scientific methodology. Most challenging to their worldview were the African-American nurses assigned to POW wards, a consequence of US military segregation that relegated black nurses to treating enemy prisoners rather than white American servicemen. German nurses observed these professionals delivering skilled treatment that contradicted every racial premise they'd been taught. Nothing illustrated American medical dominance more dramatically than penicillin. During 1943, the United States manufactured 21 billion units. By 1945, output had reached 6.8 trillion units. German medical personnel, functioning without effective antimicrobial drugs, witnessed the routine deployment of this miraculous compound. At Camp Forest in Tennessee, which accommodated German POWs and included substantial medical infrastructure, German nurses observed transformations they had deemed impossible. Infections that guaranteed death in German field hospitals cleared within days. Where German surgeons would have performed amputations, American physicians preserved limbs. American medical officers, many civilian practitioners in military uniform, shared expertise openly. This transparency toward enemies contradicted everything German medical personnel had been taught regarding warfare and medicine. The American blood plasma system represented another quantum leap beyond German capabilities. Proper typing, cross-matching, and preservation prevented the frequently fatal reactions from direct transfusion still employed by German forces. At installations like the 21st General Hospital at Rennes, France, where captured German staff operated from December 1944 onward, the blood supply system functioned with industrial-scale efficiency. Plasma preserved for months, transported thousands of miles, administered without requiring blood type matching. Capabilities German medicine hadn't achieved. German nurses trained within the NS Schwestenschaft had learned that medicine existed to serve racial enhancement. Their curriculum had included Erbe and Rassenlehre, heredity and racial studies, teaching that weak patients should be eliminated to strengthen the collective genetic pool. At facilities like the 12th Field Hospital's 30,000-bed POW operation, they witnessed the antithesis. American medical staff treated German prisoners identically to American wounded. Adversaries received the same scarce medications, surgical interventions, and nursing attention as Allied servicemen. This fundamental divergence, medicine as universal healing versus medicine as a racial instrument, began dismantling their ideological architecture. Christmas of 1943 delivered profound psychological impact. American organizations dispatched 500,000 packages to German POWs. Each contained wartime luxuries: coffee, chocolate, cigarettes, soap. At Camp Alva, Oklahoma, designated for Afrika Korps personnel, local congregations performed German Christmas hymns. Boy Scouts delivered handcrafted greeting cards. Families with sons deployed in Europe sent homemade confections. The Christmas banquet, turkey, ham, vegetables, desserts, surpassed anything German forces had experienced in years. German nurses recorded their bewilderment, enemies demonstrating Christian charity, while their own propaganda machinery preached absolute hatred. By 1944, the Special Projects Division had implemented comprehensive educational initiatives. German nurses attended lectures at institutions like the University of Nebraska Medical School at Fort Robinson. The topics revolutionized their perspective: medical ethics and patient rights, scientific methodology and clinical practice. The pedagogical approach itself, encouraging inquiry, discussion, disagreement, contradicted their authoritarian training. Access to American medical publications revealed another shock. Numerous German medical breakthroughs had been pioneered by Jewish scientists expelled under the Nazi regime. The cognitive dissonance proved overwhelming as American medical personnel deployed to the European theatre. German nurses increasingly staffed stateside military hospitals. At the 45th General Hospital in Bari, Italy, which began receiving German prisoners on July 31, 1945, they operated under direct American oversight. Colonel Charles A. Pfeffer's hospital treated all nationalities equally: Allied soldiers, Italian civilians, German POWs. German nurses found themselves applying American techniques and pharmaceuticals to treat patients their ideology had classified as inferior. American medical technology appeared decades more advanced. X-ray machines, scarce throughout Germany, were routine. Electrocardiographs, unknown to most German nurses, constituted standard equipment. At facilities like the 3rd Convalescent Hospital, operational from May through September 1945, German nurses learned to operate equipment they had only imagined. Autoclaves sterilizing in minutes rather than hours, electric suction replacing manual pumps. Even simple innovations like adjustable hospital beds represented advances. Spring 1945 brought the most devastating revelation. Liberation footage from concentration camps was screened for German POWs. Medical personnel who had served the Nazi apparatus faced the ultimate moral catastrophe. Initial denial disintegrated as evidence accumulated. Testimony from American medical officers who entered the camps. Photographs. Letters from Germany confirming the truth. They had served a system that had perverted medicine into an instrument of murder. American officers handled this professionally, emphasizing that medicine itself bore no guilt, but must never again serve ideology over healing. American authorities implemented focused denazification for medical personnel. Mandatory coursework covered medical ethics and democratic principles, utilizing case studies, demonstrating how racial medicine harmed patients, while scientific approaches preserved lives. Lieutenant Colonel Dorothy Wittmann at Campo Pellicer arranged for German nurses to observe American nursing methodologies, emphasizing documentation and patient advocacy. The message, technical proficiency without ethical practice, was insufficient. Throughout captivity, American medical abundance stunned German personnel. Hospitals discarded barely expired medications that Germany couldn't manufacture. Instruments were replaced at the first signs of wear rather than repeatedly repaired. This apparent waste demonstrated a truth that contradicted Nazi propaganda. America generated medical supplies in unlimited quantities without conquering territory. Germany fought for resources that America created through industrial capacity. American nursing practice challenged German professional identity fundamentally. Nazi hierarchy demanded absolute obedience. American nurses functioned as analytical professionals with substantial autonomy. They could challenge physicians' orders, propose alternatives, make independent decisions within their expertise. This professional model, unknown in German nursing, represented a complete reconceptualization of their role. Captain Helen Morrison at Glennon explained, "You bear responsibility for patient outcomes. If something's incorrect, voice your concerns regardless of hierarchy." This empowerment transformed their understanding of nursing itself. The presence of African American medical personnel created profound cognitive dissonance. German nurses operated under black professionals demonstrating superior knowledge and competencies. Lieutenant Elaine Powell at Camp Florence, Arizona, supervised German nursing staff with a professionalism that contradicted racial propaganda. When she corrected techniques or instructed procedures, German nurses confronted the fraudulence of their racial education. The irony wasn't subtle. American segregation assigned black nurses to enemy prisoners, yet even this flawed system produced superior outcomes to Nazi racial medicine. Following Italy's September 1943 surrender, cooperating Italian medical personnel received preferential treatment. German nurses observed former allies gaining privileges while they remained under restrictions. This pragmatic approach, evaluating current cooperation over historical allegiance, contrasted sharply with rigid Nazi ideology. Italian nurses worked freely while Germans maintaining Nazi beliefs stayed under guard. Despite their prisoner status, German nurses received medical education surpassing their homeland training. American officers taught new techniques, medications and equipment operation without restriction. Knowledge flowed freely. Burn treatment protocols from Pacific theater experience, surgical innovations from European combat zones, all taught to enemy personnel. German nurses documented everything, recognizing they would return to a devastated nation requiring medical expertise. As hostilities concluded in May 1945, American authorities prepared German medical personnel for repatriation through comprehensive training. Courses addressed public health, epidemic control, emergency medicine, skills for reconstructing Germany's medical infrastructure. They learned water purification, mass vaccination, malnutrition management. Colonel Richard Stevens told them, "You're returning to massive medical needs. This knowledge represents our investment in a democratic Germany." Training included establishing clinics with minimal resources, training auxiliary personnel, implementing public health measures. German nurses received certificates documenting their American training, credentials valuable in occupied Germany. German nurses repatriating between 1945 and 1946 discovered 60% of German hospitals destroyed. They brought not merely American techniques but a fundamentally different medical philosophy. Former POWs established nursing schools emphasizing patient advocacy over ideology. American protocols were implemented in reconstructed facilities, blood banking systems modeled on American designs, systematic antibiotic deployment following American guidelines. By November 1945, with minimal American medical personnel remaining in Germany, these American-trained Germans became essential to public health maintenance. The influence extended far beyond immediate post-war years. By 1950, many German nursing schools were directed by former POWs. They introduced concepts learned in American camps: nursing diagnosis, patient advocacy, continuous education. German pharmaceutical manufacturers adopted quality standards observed during captivity. Hospitals reorganized following American models witnessed firsthand. The transformation from ideological to scientific medicine became permanent. The statistics reveal the magnitude. Total German POWs in US, 371,683 medical facilities with German staff, over 200 documented medical education hours, 100,000 plus medical procedures performed, hundreds of thousands nursing schools established by returnees, 15 plus documented hospitals reorganized on American models, dozens in US zone. Each trained nurse influenced dozens of colleagues. Each reformed hospital treated thousands. The ripple effects multiplied exponentially. In 1995, surviving German nurses who experienced American captivity drafted a collective statement. We served the Nazi regime and subsequently became American prisoners. We testify that medicine corrupted by ideology becomes death's instrument, while medicine grounded in science and compassion serves life. Americans revealed abundance beyond our imagination: medications, technology, resources. More significantly, they demonstrated medicine without hatred. They treated adversaries as patients deserving equivalent care. We returned carrying more than medical knowledge. We brought understanding that healing transcends nationality and ideology. To future medical professionals, never permit medicine to serve ideology over healing. American doctors and nurses taught us this by treating enemies as humans deserving compassion. We arrived as prisoners. We departed as witnesses to medicine's true purpose. The transformation of German nurses in American captivity represents one of World War II's most successful ideological conversions. They witnessed not merely technological superiority, but medicine's fundamental purpose: healing without discrimination. Their journey from Nazi medical servants to scientific medicine advocates demonstrates experience's power over propaganda. Daily exposure to American medical practice accomplished what coercion couldn't: complete ideological transformation. The 9 nurses emerging from Cherbourg's underground hospital on July 2, 1944 represented thousands who would undergo this revelation. They entered captivity believing in German superiority. They departed understanding that medical excellence originates from science, resources, and universal compassion. This was America's greatest medical victory, demonstrating through daily practice that humanitarian medicine triumphs over ideological medicine. German nurses weren't simply captured. They were converted through witnessing medicine's true purpose. Their conversion established foundations for post-war German medicine's reconstruction on humanitarian rather than racial principles. In their transformation lay proof that even the most indoctrinated minds can change when confronted with undeniable evidence of a superior approach. The German nurses captured by American forces discovered that their enemies possessed not merely superior resources but superior medical philosophy. They had been taught medicine served racial ideology. They learned medicine serves humanity. That lesson, learned in American captivity, would reshape German medicine for generations. Their story stands as testament. Medicine based on science and compassion will always defeat medicine corrupted by hatred and ideology. The captured became witnesses, the enemies became colleagues. And through their transformation, medicine returned to its proper purpose: healing without borders, science without prejudice, compassion for all who suffer. If this story moved you the way it moved us, do me a favor. Hit that like button. Every single like tells YouTube to show this story to more people. Hit subscribe and turn on notifications. We're rescuing forgotten stories from dusty archives every single day. Stories of healers who transformed enemies into colleagues. Real individuals, real transformations. Share your location. Tell us if someone in your family served in the medical corps. Simply let us know you're present. Thank you for watching.